Hi, everybody. I'm Lisa Twerski, and here with me now is Dr. Richard Gallagher, who is kind enough to be coming to our conference in just a couple weeks and giving a workshop entitled Efficacious Treatments for Organizational and Executive Function Deficits in Children and Teens with ADHD, Overview and Practical Guide. Thank you for doing this. Thank you for doing this workshop. It's such a important topic, and I think of interest to many, many people in all of our different walks of life, as therapists, as people in our community, sometimes parents, siblings, etc. What are we as the clinicians going to be learning, hearing about, gaining from this workshop?
Well, I think we're gaining a couple of different things. One is that this is focusing on children and adolescents, and it is going to be a program that is focusing on treatments that have been tested and proven to be effective for helping kids with ADHD. These kids have tremendous difficulties with managing their schoolwork. It contributes to real problems with regard to making advances in school. It does result in some issues having them be involved with disengaging from school and getting less motivated for doing school, especially during the adolescent years. And it does contribute in our research to a fair amount of family conflict. So what's been presented with a lot of other resources and other ideas has been ways of kind of changing executive function skills through computer games and other methods like that. And unfortunately, they don't work. They get a lot of publicity, but they don't work. Our work and the work that Dr. Waba, my colleague who will be presenting at the meeting as well, is work that's been tested out and goes directly to the things that the kids are doing day to day, not their computer games.
Right. They get enough computer games as a way of managing them by their parents that's probably not where you want to send them to also do their executive function work.
Right. Because the games are engaging, but they do only have an effect so far in terms of testing to improve the kids' performance on similar computer activities. They don't transfer to school, and the teachers don't see changes in their behaviors at school. Our work and the work that we're going to be reviewing, Dr. Margaret Sibley's work that's been tested out in a variety of different studies, and these are real hardcore randomized controlled trials, does work on helping the kids learn what tools and routines to use for tracking assignments, what to do for managing their materials, what to do for managing their time, and how they can get much better at planning. And it really is quite concrete. And we think that this program will be serving a good foundation for understanding how to do this work in practice.
Oh, wow. So we'll be kind of going away with some ideas of how to practically help the kids in our practices who are struggling with this, who to this point have not really gained what they need to.
Right, exactly. We are going to be talking about manuals that are available in the form of books that are based upon this research, working with a lot of kids. The studies that have been involved have done studies with over 100 kids in both cases.
Wow.
So this has really been tested out pretty extensively.
Right. Tell us a little bit about your work and where you're doing this work so people can understand the backdrop of what makes you such an expert, yourself and Dr. Waba, such experts specifically on this and on the research surrounding this.
Okay. We are both faculty members at the NYU Grossman School of Medicine in the Department of Child and Adolescent Psychiatry. And about, in the case of our work directly, is within elementary school age kids. We started about a little over 14 years ago, and it was working on emphasizing and understanding what are the organizational skills problems that kids with ADHD have. We developed a measure for evaluating that. We found kids are variable. Kids with ADHD, about 70% are showing impairing problems in these areas. And we then had an opportunity to get funded for developing and then testing out a protocol that is done with the kids, incorporating their parents, incorporating their teachers, and actually teaching them how to practice these methods and put them into place. The tests ended up with really good results. The other program that Dr. Wab is going to talk about, who is a faculty member, but also a former postdoctoral person that was involved in our research
Mhm.
and has been with us for several years, has going to be focusing on the work that's been done in dealing with adolescents in middle school and high school. And again, talking about exactly how to engage the family, exactly how to get the adolescent motivated, even though they're sometimes burned out and sometimes the parents are burned out.
Yeah.
And then talking about the tools and routines that have been found to be effective with managing all the demands in middle school and high school.
Wow. Wow.
So
Well, yeah.
combined, we have a lot of time in working on these efforts.
Yeah, and really grounded in the experience, the research, and I think that people will want to take advantage not just of the workshop, but of the connection with
Mhm.
yourself and Dr. Waba, and how else we can help these kids, or what connections we can make. Network Nefesh is all about the networking
Mhm.
and the collaborating and the making new contacts. And we really appreciate you coming to do this, because I think it's a tremendous, potentially a tremendous resource in contact and networking, in addition to the actual workshop and information we'll be gaining from that. So I really appreciate you doing that and this.
And if I may add one other point, this work that we were talking about is primarily done in clinic settings with kids individually. However, we are aware, and we've actually done some of it ourselves, to do this in school-based programs as well, with small groups of kids. And we have information from a study that's been conducted out of the Children's Hospital of Philadelphia about an effective effort with kids in schools that worked out. And that there's also programs that have been designed for kids in middle school in the school and school-based delivery. And many of the kids in the studies, in our particular study, have been kids from dual curriculum schools. So we have a pretty good sense of how to be able to apply this in a school setting as well as within the clinic setting.
Wow. Well, this is, for a wide range of people, it sounds like both people in private practice, clinic practice, but also school-based practice are really going to want to come and hear and learn and connect. And we're getting close. We're about 2 weeks away from the conference, everybody. So I'm looking forward to seeing you and seeing